And that's another reason why it isn't just like slapping a sticker and being like, you're trans. Like, the endocrinologist in the bushes, it's like, let's go trans them. There's a little boy playing with a doll. So, hi everyone. So as I have been putting in my media stuff, I'm starting my channel with 5 videos. If this is the first one you've watched, my name is Ria Rosella. My pronouns are she, her. I'm a gender-affirming therapist. The different types of content I want to make on this channel is about 5 different types of videos. Why I'm launching it that way. And in my very first Ask a Therapist video, a question was kind of related to how do you get the courage to start transition? And I wanted to go into an even deeper dive in an educational video on what gender-affirming care is. So that's what this is going to be about. If you find it helpful, please like, subscribe, share it around, give it to maybe someone who you know is at the beginning of your journey, because ultimately this information is for them. Or maybe you have a parent that's like, they're making the kids trans because they're not challenging them at all. And there's just this big misunderstanding of what gender affirming care ultimately is. This is the video for you to give them, spread around, all of those things. I guess I'd like to start with what is gender affirming care? Well, gender affirming care is mental health and medical practices to help trans people determine what their gender is, for lack of a better term. It's care to support them in that journey, in that process, and help them ultimately maximize gender euphoria and minimize gender dysphoria. To define those things, gender euphoria is good, happy sense of oneness feelings with being transgender. Gender dysphoria is dread, dislike, negative feelings associated with being seen as the gender typically you were assigned at birth, or being seen as a gender that you aren't actually. So you think harmony, disharmony. My role as a therapist is to support someone in that process to determine what is right for them, if they're sure the journey is right for them, and if they are sure, to also help them with co-occurring issues that could be a part of it. Oh, by the way, I should say, there are people in the audience that can ask questions at times. When I record these educational segments, I'm going to try to have people in the audience. And eventually, it might even become a Patreon exclusive if so many people want to do it. So anyway, back to the topic at hand. I treat gender-affirming therapy as a self-archaeological dig. And what I mean by that is that essentially you know where you're at right now in your gender journey. You have a idea, okay, maybe I have some confusion, maybe I think I'm non-binary at this point, maybe I'm definitely sure I'm trans, or maybe you're just questioning and you don't know anything. You just know that right now, where you're at doesn't feel good. We affirm that's the affirming and gender affirming care, is that we affirm where we're at now, but then we need to explore to make sure, and like in archaeology, when you're brushing off layer by layer, we're going to do a lot of different things, and maybe the idea of what your gender is by the end of it is something where you're ultimately oh, I started thinking I was a trans girl, and now I think I'm a demigirl, or I started thinking that I was definitely trans, and actually, I'm just a gender nonconforming cis person. And these are things that people, through working with me, have all experienced. So it is a process where we just bit by bit by bit try to figure out if it's right for you. So the way that process typically starts is kind of a biopsychosocial. It's this thing where I ultimately kind of get a snapshot of who you are right now. That includes gender. Then we do specific actions to explore different gender expressions. Gender expressions is ways that you show your gender to the world, which may or may not be in alignment with your gender identity, your felt sense of what your gender is. And you basically, by trying on those different things, it's like you're trying on different sweaters to see if it's warm and cozy or itchy and scratchy. And you're kind of taking note in reflection with your mental health care provider, what is right for you and what isn't right for you. And then you continue this process, and then eventually, and I guess I could go into some different examples of different things. So, as a lot of people know, VR chat is a place where you can explore your gender with different avatars, try on different gender expressions. That's a thing that you can do. And this is a great place for that. It's also a low stakes space. You're not having to try buy different clothes. You're not having to, spend a lot of money on hormones that you're not sure that you want, or anything. It's very it has a very low entry point. But you can even do that in a Discord, a gender pronoun role, bam, gender exploration. And it kind of goes up and up and up as things go. Yes.
Is there servers you can recommend for gender affirming, to be gender affirmed?
Yeah, so if you're in VR chat, of course, it's the Trans Academy is ultimately the number one stop for trans people in VR. I believe if you're in other spaces, for example, another place trans people hang out is Final Fantasy XIV, specifically trans feminine people. I'm sure there are guilds specifically for trans people. There are spaces. Look for your fellow people that are ultimately, even if you're not sure you're trans, but if you want to have people who understand and get it, that's ultimately the space for you to explore. So Trans Academy in VR, it's associated with the trans group. That's how you can find them. It's also discord.gg/join Trans Academy or something to that effect. I'll put it in the description, but you can join them, and that's a place where you can explore. Editing Rhea here. Another place you can explore is actually on our patron Discord server. For $1 a month, you can join the patron Discord server. Thanks. But it's going to have to go up and up from there. And especially, and this is the part that people don't understand about gender affirming care, is that I kind of implied it before, but I want to say it very, very explicitly. You're going to try genders that you don't think are yours in order to get information on the ones that are yours. If you want to think of it like a strategy game where you're building the fog of war and you're trying to essentially clear the whole map to make sure that you know everything that's there. So when I work with people, let's say they come to me and they think that they're a trans girl. Cool, great. We're going to explore what it's like to be a boy or a man, depending on how old they are. We're going to explore what it's like to be non-binary or different flavors of non-binary, like non-binary femme, non-binary masc, trans feminine high femme, trans feminine androgynous, trans feminine butch. All these different gender expressions ultimately to determine if it's right for you. And maybe you're doing that mostly in virtual worlds because the bar for entry is so low. But eventually, when you kind of have that picture more clear, you're going to have to take it to the real world. And that's scary. That involves coming out. It involves usually a big rigmarole for getting people to know that you're trans outside of your online spaces. Typically, people start with their most trusted people, and they start in their personal life, if that's available to them, and there isn't any issues with discrimination. I think there are some people who will move if they need to, depending on their age and situation. If they feel that the people in their life won't be supportive, it's kind of one of those things that are real. But usually people start on the personal, and then they move to different spaces. Maybe even they'll do a fog of war with their personal life. They'll be like, oh, these queer weirdos I went to high school with, they'll get it. I'm going to tell them basically first. My best friend forever, maybe they're queer because we run in packs. I'll tell them. But maybe I'm not going to tell my siblings or my parents or my extended family. Well, maybe I'll never tell my extended family. These are things that people ultimately have to make decisions on what's important for them, and their care providers can help them weigh the pros and cons of every step along the way. That's a part of gender affirming care. The WPATH, which stands for World Professional Organization for Transgender Health, are the people that basically decide what the guidelines are for gender affirming care. What I've given you is a very brief overview of like the therapy part of like the exploration, but there's more to it. For example, in the WPATH, it says that you have to be either aware, like, and knowledgeable of neurodivergence, particularly autism, if you are doing gender affirming care because of the large overlap of those identities. And if you aren't aware, you need to be consulting with another professional that is aware about autism. They talk about like they've in the standard of care's 8, there's been 8 different versions of this. They are essentially talking about how they don't want to set like hard ages for like when like certain things should or shouldn't happen. They ultimately want to, in an ideal world, when people aren't legislating against us, they want us to be able to determine on client need. Editing Rhea again. Need is a bit of a misnomer here. What they're actually looking at is psychological distress and risk to the patient, for example, risk to their life via extreme gender dysphoria leading to unaliving. More about that later. And by the way, it doesn't necessarily have to be in care. It is aware of their trans identity. A lot of people know it in youth. A lot of people find out at puberty. Those are kind of the certain like times that people ultimately are like feeling that they might be trans most of the time, but not always. And so I'm going to put on the screen, I'm going to like step to the side more. There is like a list of guidelines. So if needed, editing me, explain stuff. All right, past me. I think it's time for a deeper dive than you were probably bargaining for. While I'm not going to go through every single possible section, you can see that there are many. I'm going to focus on assessments of adults, adolescents, and children. If in the future we want to go into the other sections where relevant, please reach out in the comments. So concerning adults, you'll notice that most of the things on this list are in alignment with what I've already talked about or will talk about. The things I really want to focus on is it's really about consent. It's about understanding risks for any medical interventions. It's about working to identify any other psychosocial concerns and distinguish them from gender dysphoria or any gender incongruence. And to do that, you have to be qualified to assess gender dysphoria / gender incongruence and do continuing education concerning gender dysphoria or incongruence. And I think you'll hear me say this in probably all of the sections. To make sure the gender incongruence or gender dysphoria is over a marked sustained period of time. So I think you'll see while looking at this criteria that everything I said with adults applies, but then you have to add the issues concerning adolescence / child development, what is typical, working with their parents and other adults in the child's life, as well as an interdisciplinary health team to ensure that any gender interventions are right for them. And something to note that, conversion therapy is not recommended, that a exploration of many genders, like I said, and no one gender is favored, is part of the process with working with really anyone, but adolescents in particular, because of that identity development, making sure that any neurodiversity is addressed and supported, assessing the cognitive capacity of the adolescent to assent to gender-affirming medical care if the distress is marked and sustained over time, to ensure that the teen is aware of sexual dysfunction that may occur from blocking puberty if that is what's needed, slash helping preserve fertility if that is desired, or ensuring the adolescent is aware of all options. And while this isn't really related to therapy, one thing I want to note, because it's a common misunderstanding, is that trans adolescents do go through puberty even if their puberty is blocked. It is blocked at Tanner stage 2, and some conservatives will say that, oh, if you let a child grow into adolescence and grow into puberty, they won't be trans anymore. That is a blatant mischaracterization. It is from a study that mischaracterized gender incongruence and actually the old gender identity disorder with being trans, with having gender dysphoria. But even if that were the case, they go through puberty up to Tanner stage 2. And finally, and I know I said it a little bit before, but you have to also have the parents involved unless there is a clear reason, like abuse or neglect or something like that, why they wouldn't be involved, as well as marked sustained gender dysphoria slash incongruence for a long period of time. The DSM says a minimum of 6 months, but usually for anything medical, we're looking at years. That is what is common, unless there is such distress that the teen's life is at risk. And for children, you'll notice that not everything for adolescents, but for assessment and knowledge required, most of that is the same. The biggest difference is you'll notice there's no surgical anything with children. Children, the only medical, scare quotes, care that they receive is social transition and just a bunch of support for being a minority. Building resilience, helping them ensure that this is right for them, like I've said throughout this presentation. You'll also notice an increased emphasis on families and systems around the gender diverse child. Because if I could sum up gender affirming care for children, other than me, as always, emphasizing that any distress or gender realization be marked and sustained over time, especially in a solidified identity before we reach adolescence and anything other than social transition is done, is that it is about support. But that support does not mean that you don't question. I want to emphasize that because I know that is a big fear. As I said, you go through that whole archaeology process. All right, back to your regularly scheduled past RIA. That is, in a nutshell, what gender affirming like therapy is. The only other thing that I haven't mentioned is often there's a lot of minority stress for being trans. Usually there's trauma associated with being in a society that doesn't see you. Maybe there's just trauma from also being neurodivergent or anxious or like all of these co-occurring things that can happen. A gender affirming therapist is supposed to, and it's part of their duty by the WPATH, to help them also with these co-occurring issues. This doesn't mean they're not trans, to be clear. It just means because they are trans or because they experience issues that are related to gender, they may have these different types of stuff. And those are the type of things that ultimately have to be addressed in order to help people with gender affirming stuff, is you have to get the whole person. And that's another reason why it isn't just like slapping a sticker and being like, you're trans. Like, the endocrinologist in the bushes, it's like, let's go trans them. There's a little boy playing with a doll. That they don't do that. And
they're putting chemicals in the water that trans my gender.
Exactly. So, I guess before I just kind of maybe briefly go on like the part that isn't my bag, like the actual medical stuff, does anyone in the audience have any questions, or maybe they want to briefly share about their experience doing what I've been describing? Maria?
In my experience, gender affirming therapy is definitely. I would recommend it for anybody who feels like they're having a gender crisis and they need someone to help them figure it out. I can
Mm-hmm.
100% recommend it.
Cool. you said you can recommend it. I assume that's from personal experience. Have you,
Yes, therapy, at least in where my area is, gender affirming care and therapy is amazing here. We have a
good.
lot of people with experience.
All right. Any other questions before I move on? It is okay to say no or not say anything, and I can just dance up here. All right, fantastic. So, the only other thing I guess I want to briefly go over is kind of what to expect if you choose to medically transition. Typically, the WPATH lays out so that between 0 and 1 month, hormones or HRT or hormone replacement therapy is fully reversible for the most part. Maybe when we get towards the 1 month in, it might not be. But especially for the first few weeks, it's considered a fully reversible intervention. When we start getting at 1 month to 3 months, we start getting to partial reversible interventions. What that looks like is, like, for example, if you are on estrogen between 1 and 3 months, you might have some breast budding. That's not going to go away completely. The fat will redistribute away from your chest with time, but maybe those tiny little buds are there. That's a thing that might be there. Additionally, say you're on testosterone. Maybe your voice has started to drop by then. Maybe you have like some body hair you didn't have before. Those things aren't going to go away just because you stop the testosterone. So that's the 1 to 3 months. Once we get from 3+, we start getting into permanent interventions. Also, obviously, surgeries and other interventions like laser hair removal are permanent interventions. Statistically, if I remember off the number, they have done studies of people who, if they experience gender dysphoria in adolescence or older, and they go through the process, study after study, not a single person has left being trans. There has been bigger studies that show that about 1% of people detransition. There's like, oh, the scary detransition. But even that is more complicated because essentially half of those people are detransitioning because they didn't get support for their gender stuff. It's not that they aren't trans. So you're looking at basically 0.5% of people who begin this process, if they begin identifying as trans at adolescence or older, typically they're trans for life. These interventions have more, especially if you look at gender affirming surgery, they have more satisfaction than knee replacements at 13%. 99% of people who get gender affirming surgeries are happy with the result, assuming there is no botched surgery, of course. Like if the surgery goes the way it's supposed to, 99% of people are happy with the results. This care is safe, effective, and if you have been listening, it's not like we go from day 1 of therapy, you're trans, to day 2, you begin transitioning. There is an entire exploration process, again, that slow dig where you are ultimately uncovering yourself. It's about finding yourself, not making yourself be something. And that's gender affirming care. As I said earlier, please, if you found this helpful, subscribe, share this around. Go watch the other 5 videos that are on this channel, assuming past or future me ultimately lives up to past me's expectations of trying to launch with 5 videos. But thank you for listening. Y'all are awesome. And if you have any questions, put them in the comments, or you can always submit on the Google form. Thank you so much, everyone. Bye. And stop recording. You want to say bye, audience? Bye.
Bye
Okay.
bye.
Bye. Yay. Hi, and this is the end card. Thank you for getting to the end of the video. If you watched the whole thing, can I get a butterfly emoji in the comments? I just wanted to say thank you for all the support that you've given me throughout this launch process. I really appreciate it. Please watch all 5 videos of this launch. And please, if you have any funds, join the Patreon. We have for just $1 a month. You can join the patron Discord, And for 5 or more, you get other perks, such as getting your name in the credits. Thank you so much, y'all. Bye. Mwah.